It's a real shift in kind of just how you think and do prenatal care.
For decades, women have met with their doctors throughout pregnancy talking about all kinds of private and important things. But something's starting in Iowa City that's taking some of that privacy away.
Emily Price headed east to show us how it's also adding much more, including healthier babies. It's new at 10.
On one table inside the University of Iowa hospitals and clinics, Laura Delos sees one pregnant patient.
And this baby's moving?
Yes, lots.
After another pregnant patient.
All right.
For these women, their 27-week checkup is happening at the same time. Everything from hearing their baby's heartbeat to learning their own blood pressure.
I was a little bit concerned, but because your personal information is done aside from the rest of the group, then when you're with the group, you can just share whatever you feel comfortable sharing, and there's no pressure to share.
For Rachel Salamo and her husband, it's their second baby, but first centering class. Midwife Laura Delos helped begin the program last year.
The average woman in traditional one-on-one visits gets about 3 hours of prenatal care, anywhere from 2 to 4, depending on her site. And in centering, it's more like 16 to 18 hours of prenatal care.
The classes last more than an hour, and the women meet throughout pregnancy, talking about everything from breastfeeding and exercise to nutrition and labor.
Just hearing the other questions that women in the group have definitely made a light bulb go off, like, oh, I never thought about that.
Every day in the womb is worth probably 3 outside the womb.
Dr. Rachel Mawson says places that have had centering pregnancy for a while have seen a dramatic drop in babies born early, extending some pregnancies by an average of 2 weeks.
And I don't think we really understand why that is. People theorize that maybe there's less stress, or maybe we have healthier behaviors. We certainly talk so much more about diet, about exercise, stress management.
They may not know why, but with positive results leading to healthier babies and happier moms, they're not exactly in search of an answer.
That I've just come to realize in life that you learn a lot from each other.
In Iowa City, Emily Price, KCCI News Channel 8, Iowa's news leader.
And the March of Dimes recognizes centering pregnancy as an evidence-based, effective prenatal care model. Their research shows 96% of women prefer receiving prenatal care in groups. The centering program in Iowa City is the only one in the state.